Okay, thank you, Mr. Chair. I'm here to present Senate Bill 41, which will require transparency and put a stop to abusive practices by pharmacy benefit managers or PBMs, practices that are leading to increase the cost of prescription drugs and that are killing off neighborhood pharmacies. I want to thank the committee for working with us, and I'm happy to accept the committee's amendments. PBMs started off as small administrative entities designed to help health plans to put together formularies and negotiate drug prices. Welcome, Assemblymember. They have now grown over the decades into mega players in the healthcare space, sometimes bigger than health plans, merged with health plans, integrated. They own their own pharmacies, and they have huge leverage in determining what goes onto a formulary, setting the costs, and really determining where people can get and how they can get their prescription drugs. We're seeing, first of all, a practice that kills off neighborhood pharmacies called patient steering, where PBMs effectively force people to use their own mail order pharmacies instead of their chosen neighborhood pharmacies where they can interact with a pharmacist face to face. And so we sometimes people see this most commonly when you're told if you go through the mail order pharmacy, you can get a 90-day supply. But if you have the gall to want to go to your neighborhood pharmacy, you only get a 30-day supply. That is a classic form of manipulation, patient steering, and that's just one example. This bill will put an end to that practice. The bill also ends a number of compensation structures for PBMs that lead to rising costs. For example, making sure that for rebates, that the entirety of a rebate that a PBM negotiates with a drug manufacturer gets passed through. Right now, PBMs will keep a portion, a slice of the rebate, and so the higher the rebate, the higher their compensation, meaning the higher the drug costs, the higher their compensation. It also puts a stop to spread pricing, where PBMs get paid a certain amount by a health plan and then pay less to the pharmacy. The bill will also create more transparency. I want to say that I'm very pleased that we were able to work with the governor, with the administration, so that the licensure piece of this bill was passed as part of the budget, and that's now underway. And now it's time to address the practices that are causing so many problems in the health sector. I respectfully ask for your aye votes. And with me today to testify is our two pharmacists, Clint Hopkins, the owner of Pucci's Pharmacy here in Sacramento, and Sonia Frausto, owner of 10 Acres Pharmacy.
Thank you. Begin whenever you're ready.
Good morning, Mr. Chair and members. I'm Dr. Clint Hopkins, pharmacist owner of Pucci's Pharmacy, independently owned in Sacramento since 1930. PBMs own health plans, the pharmacy down the street, the mail-order pharmacy to where they steer patients, and they dictate contracts which underpay and force pharmacies to close. Multiple state and federal investigations have exposed this financially irresponsible industry. Our own Medi-Cal, which went to a pass-through model, is a shining example of reining in PBM abuse. Even before the Rite Aid closures, numerous community pharmacies were closing, creating pharmacy deserts. When their patients come to us, we often have to explain that their drugs are reimbursed below acquisition costs, likely the reason that their previous pharmacy closed. Each day, it seems we spend more time explaining to patients why we cannot help them than we do counseling patients actually picking up medications from our pharmacy. PBMs limit which drugs can be dispensed locally and reserve the most profitable drugs for their own pharmacies. Just last week, we were contacted by a patient who was forced to use the PBM-owned pharmacy for a specialty medication. He's a federal employee forced to use mail order by Caremark, who manages the benefits for federal employees. His med is a generic that doesn't cost very much. He's not happy with the mail service. He's run out of meds multiple times due to their delays, missing doses, and putting him at risk of a disease which could be prevented by allowing him local access. And the kicker, they've been charging him $60 each month, when he could have just paid $50 out of pocket for this specialty medication from a local pharmacy and had the med the same day. The week before, a child of 8 months old was forced to use specialty pharmacy for their med. The average pharmacy would charge $120 for a bottle of this med. CVS mail order will likely pay themselves in excess of $1,300 for the same drug, sitting on the shelf in my pharmacy, and her parents had to wait for no reason other than profit. The opposition has cited that they pay some pharmacies more than they pay their own. I challenge them to bring such a pharmacy forward to provide testimony, but you'll be more likely to meet the Muffin Man, yes, the one that lives on Drury Lane, than you will because such a pharmacist, because both only exist in fairy tales. Without SB 41, PBMs will continue to run afoul, causing more pharmacies to close, local jobs to be lost, and patients to lose access to health care in their communities. For far too long, PBMs have operated in the shadows, extracting exorbitant amounts of money from the system they've designed. I respectfully request your aye vote on SB 41.
Thank you.
Wow, I don't have a Muffin Man. But my name is Sonia Frosto. I'm the owner of 10 Acres Pharmacy. Last week, we testified. I'm sorry, I'm going to be pretty emotional because I just announced my pharmacy will be closing on August 20th. And not because we don't have a lot of patients. We've grown tremendously, but because I can't afford to keep open. Our pharmacy practices with compassion and honesty and transparency with all of our patients. We've had 5 pharmacies close within a 5-mile radius. We've absorbed a lot of those patients. And sometimes I have to turn patients away because I can't afford to have their medications because I am underpaid significantly. Last week, I told my I told my staff, and they were heartbroken because obviously they're losing jobs. I testified last Tuesday, completely lost it like this because I knew what I was going to have to do this week. Yesterday, I had to tell my patients, and the outpouring of love and support was tremendous. They tried to figure out how we could stay open, bake sales, lemonade stands, you name it. I think I had a really high, successful sell-through yesterday. But the reality is that I had patients that had just transferred from Rite Aid who had closed their doors just weeks ago and found me and were so happy. And then I had to tell them yesterday that I can no longer serve them because we will also be closing on 8/20. This is awful because not only am I a pharmacist who provides healthcare, I'm a friend to a lot of these patients that come in. I've seen patients have babies and their kids come to our pharmacy, have good relationships with a pharmacist. That's sometimes your first healthcare relationship. And to see that go away in a community that desperately needs a pharmacy is outrageous. I have students who dream of opening a pharmacy and called me this weekend and asked me what was I thinking, why could I not survive? And I had to be honest with them and tell them that it is because I am under-reimbursed consistently from these PBMs. I can't even make payroll sometimes. It's pretty sad. Support SB 41. So my students can have a dream.
Thank you.
And come visit me.
Thank you. Is there anyone else here in support of SB 41?
Thank you. Katie Van Dynes with Health Access California in support. Thank you.
Thank you.
Michelle Rivas, California Pharmacists Association, co-sponsor and support.
Thank you.
Michelle Johnston, National Multiple Sclerosis Society, in support.
Thank you.
Lori Martinez, California Board of Pharmacy, in support.
Thank you.
Fred Notwer, representing the Pharmaceutical Research and Manufacturers of America, in support. Thank you.
Thank you.
Colette Madden, representing California Rheumatology Alliance, in support.
Thank you.
Thank you, Mr. Chair and members. Megan Subers on behalf of the Los Angeles LGBT Center, co-sponsor and support.
Thank you.
Good morning, Jonathan Clay on behalf of USC Keck School of Medicine in support.
Thank you.
Mr. Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation in strong support. Thank you.
Good morning. Shira Spector with Stone Advocacy on behalf of the California Orthopedic Association, in support. Thank you.
Thank you.
Good morning. George Cruz on behalf of the California Access Coalition in support.
Thank you.
Good morning. Ryan Souza on behalf of the San Francisco AIDS Foundation, a co-sponsor, and APLA Health in support. Thank you.
Kevin Guzman with the California Medical Association in support.
Thank you.
Good morning, Mr. Chair and members. Andres Ramirez with Blue Shield of California in support.
Thank you.
Jessica Moran on behalf of the National Association of Chain Drugstores, in support.
Thank you.
Good morning, Chair. Gilbert Lara here on behalf of Biocom California in support.
Thank you.
Good morning. Tim Valderrama with the Weidemann Group on behalf of the California Society of Health System Pharmacists in support.
Thank you.
Good morning. Alex Kahn on behalf of the California Chronic Care Coalition, a proud co-sponsor, and the ALS Association in support.
Thank you.
there, Colin Meissner as a resident and patient in support.
Thank you. Is there,
Hello. Good morning. Sorry for the last minute rush. Sylvia Solis Shaw here on behalf of the California Academy of Child and Adolescent Psychiatry and Support. Thank you.
Thank you. Is there anyone here in opposition to SB 41?
Good morning, Chair and members. Allison Ramey here today on behalf of the Pharmaceutical Care Management Association in opposition to SB 41. It's worth noting that SB 41 is largely a reintroduction of SB 966, which, while passed by this legislature, was vetoed by the governor, with the governor's veto message being that he wanted greater transparency across the drug supply chain, but did acknowledge that there needed to be some focus on PBMs. This legislature helped him achieve those goals with the passage of AB 116 just 2 weeks ago that was signed into law that will now require PBMs to be licensed by the Department of Managed Healthcare and report a large amount of data to the Office of Healthcare Affordability, including contract terms, reimbursement rates, how those reimbursement rates differ between independent pharmacies and chain pharmacies and affiliate pharmacies, amongst a number of other things, including rebates, which we know this legislature has a lot of interest in learning more about. Soon, come 2026, this legislature will be armed with data that hopefully can put an end to the finger pointing you all have learned and heard about between PBMs, drug manufacturers, and others about who is to blame for the high price of prescription drugs and make sound policy decision. SB 41 steps in and ignores the opportunity that that data brings you all and instead makes policy decisions that take away PBM tools and limit client choice. It's important that this committee know that clients, PBM clients being the state, large employers, small employers, union trusts, do not have to use PBMs. They choose to use PBMs because they are successful in negotiating lower drug prices and putting together pharmacy networks and pharmacy benefits that they can provide to their employees and members at the most affordable price. We acknowledge the value and the importance of independent pharmacies. PBMs cannot create networks without them, and we are open to those conversations, but SB 41 is not going to do anything to lower the price of prescription drugs for consumers. For that reason, we ask for your no vote.
Thank you.
Mr. Chair, members, John Winger here on behalf of America's Health Insurance Plans. We're the National Trade Association for the Health Plans. I think to PCMA's point, willing to have that conversation about pharmacy. Obviously, we have to have adequate networks, and pharmacies are an important component of that, and so willing to have those discussions. Not going to relitigate everything that was discussed in Health Committee, but there are a lot of provisions of the bill related to the manufacturers and taking away tools in the tool chest from the PBM's perspective in order to reduce the cost of drugs, which has an impact on the payers who voluntarily hire them. But specific to, I think, this committee, our AHIP's biggest concern with the bill is around ERISA preemption. The Supreme Court ruled in 2020 that a lot of the provisions of this bill would be preempted by federal law. Anything that gets into the actual health plan administration and is directly related to the health plan's benefit design is preempted under ERISA. There were some very narrow exceptions to that were not preempted by ERISA that the state could do related to pharmacy reimbursement and a couple other things, but this bill goes well beyond that. There's been recent litigation in the 10th Circuit as well that's also reaffirmed this, and so we continue to believe that the inclusion of self-insured plans in the bill is going to be preempted by ERISA. Thank you.
Thank you. Is there anyone else here in opposition to SB 41? Okay, we'll bring it back to the committee. Any questions or comments? Madam Vice Chair?
Thank you, Mr. Chair. Thank you, Senator, for bringing this forward again. A couple questions for clarification. Could you explain how this bill is different? I supported last year's bill, so what's different this year?
It's similar to last year. Enormous respect for the governor, and he has the right to veto a bill, but this is a bill that you'll recall passed with almost unanimous bipartisan support last year. And I'm really grateful that the governor worked with us in the budget to put the licensure piece in the budget. I think that was a step forward, and we look forward to working with the governor and having dialogue with the administration about the details of the bill. I do just want to respectfully disagree with the characterization of the budget trailer bill. The licensure piece that got put into the budget trailer bill was not in lieu of regulation. It was a piece of SB 41, and it was placed into the budget because that means that the licensure can be stood up. I don't know if that's grammatically correct. We stood up more quickly. Otherwise, we'd have to wait until next fiscal year to stand it up. So by putting it into the budget, they can get to work immediately in getting the licensure in place. And so once the rules are passed and go into effect January 1st, they'll be ready to go. So they're complementary.
I was just going to say they're complementary. They work together. And then if you could also address the ERISA issue, please.
Yeah, we disagree. And in fact, there was a Supreme Court case out of Arkansas that upheld state level PBM regulation. That bill was not exactly the same as this bill, but we understand that's their argument, and they have every right to raise that argument here or in court, but we disagree with their legal analysis.
And then one final question. Other states, I mean, how does this affect the industry and working through PBMs? Have other states taken similar action?
Yeah, other states have enacted regulations. California is a bit behind here. I will also say there is bipartisan support in Congress to regulate PBMs. This is not a very controversial issue among policymakers. I hope that at some point Congress does that, but they haven't yet. But there has been bipartisan support.
Well, very good. And just my empathy for independent pharmacies. I have them in my own community, and I had no idea when you had your bill last year. I went around and visited independent pharmacies in various parts of Orange County, what I represent, and I was shocked because I didn't know, and it was a big education what we've been going through. And last year was very confusing. Now I understand it a lot more clearly, and I'm fully supportive of your bill and wish you success in here. I mean, my heart goes out to the independent pharmacists. It's just heartbreaking to see that they can't afford payroll because of the price of drugs. Thank you very much. I appreciate it. Thank you, Chair.
Thank you. Assemblymember Pappen.
Well, good morning.
Morning.
I feel like we see each other quite regularly.
That time of
so
year.
I want to thank you, Senator Wiener, for bringing this bill and for your continued leadership on the issue. As you know, my district has a lot of biotech in it. I would like to say that we are the biotech capital of the world, and I'm very proud of that. And as you well know, these innovators are discovering new cures every single day. And I think that their success and our access to those cures depends upon scientific merit, and fairness in pricing. So that's why I'm a fan of the bill. I just think that the way it's set up now, PBMs actually punish companies for having lower prices. And my heart goes out to you, independent folks. You are so personal in how you conduct your business. And it is a very personal business in a lot of ways. So I think, just to digress a moment, I thank you for your efforts in that regard. It is very important to the health and mental health of your patients, certainly, to know who's administering their drugs. But in any event, I think your bill is going to bring some daylight to this issue. And it's going to help level the playing field for biotech and generic manufacturers who are really just trying to compete. So I have no questions. I just want to say I'm a strong supporter, especially given my district and my admiration for especially the independent pharmacies.
Assemblymember Harabedian.
Thank you, Mr. Chair. Thank you to the author. Thank you to all the witnesses. Question to the author just about the confidentiality provisions. So obviously AB 116 was passed, very strict confidentiality provisions in that bill, and now this bill is coming. And I think what's problematic for a lot of us is that under now the existing law, which I'm not sure how this bill interfaces with it, private industry can essentially dictate what records that are held by DMHC are disclosed as public records or not. And I think that's problematic. It's sort of unprecedented to have any private industry dictate what records the Attorney General can access to actually pursue cases, for example. Are you addressing this? Are you committed to addressing it in this bill? And if not, I'm not exactly sure why we are allowing this sort of strict confidentiality to exist in this space where it doesn't exist in other spaces. So can you address that and just help me learn a little bit about why this is different than, frankly, and obviously the California Public Records Act dictates something completely different. And I think we talked about that yesterday on the assembly floor. I am a little worried that this is in contradiction with 116 and with CPRA now. So can you just speak to that for me?
Yeah, and that was all negotiated as part of the budget with the administration, and that is something that we're going to be taking a look at and working with the administration on.
Okay, so we are committed to hopefully, because I do think that the staff analysis has proposed, I think, some good pathways forward. Maybe not necessarily through this bill, but to address this, because I think
we're committed to working with the committee and with the administration to resolve the issue.
Appreciate that. And then I guess the second bucket of questions I have are just generally, to the extent that anyone understands this, they are smarter than I am. Because I will say that this is probably one of the most opaque areas of policy and the law that I've encountered in my short time here. And even after reading this incredible analysis and the bill, I still don't fully understand it. What I am concerned about, and I think that what's driving this bill is cost, I would hope, and trying to make sure that consumers are paying less for their pharmaceuticals and their drugs and not more. What I'm concerned about is this bill doesn't necessarily predict that or ensure that. So I guess, is there anything, obviously pharmaceutical companies dictate the price of their drugs, of the pharmaceuticals that they sell. PBMs have their role in setting the ultimate price that consumers pay, and this has to do with PBMs. Does the bill have anything to ensure that consumers, to the extent that we're saving money by these regulations, the consumer actually will pay lower drug prices? Or could pharmaceutical companies just raise the prices or just keep all the money that's being saved from PBMs?
So, first of all, I would never suggest that one bill solves every problem in terms of the cost of the healthcare.
And I would never hold you to that
healthcare system. And I know you're not suggesting that. There will still be negotiation with pharmaceutical companies, regardless of what the compensation structure is for PBMs. We know that right now PBMs have an incentive to favor higher cost drugs because that means that they get more rebate revenue. The higher the drug cost, the higher the rebate, which is a percentage of the drug cost, and the higher their cut of that rebate. In terms of if you have a overall savings to the healthcare system, whenever those costs go up, we all pay more through insurance rates, et cetera. And so whether the consumer is getting a direct financial benefit or whether the costs are going down in the system overall, it's to the benefit of everyone. So one way or the other, there will be benefits. This is about reducing overall costs in the healthcare system, first and foremost.
But there's nothing I appreciate that. And we see a lot of bills like this where, frankly, it feels like we're caught in the middle of a battle and a war of two giants. And maybe one giant and one, slightly less big giant. And frankly, it's about cost. And frankly, there's never anything in our bills that there's no provision that triggers that any savings will be passed on to the consumer. And so this isn't just about this bill necessarily, but why not include things in our bills where frankly, we're trying to do what you're trying to do that ensures that cost savings actually are passed down to the consumer?
We can do that, and we can make those choices in a lot of bills about how the cost savings are passed along. But I want to just be clear what's happening here. So we have this system in place where we have a patient here, we have their providers, doctors, et cetera, here. We have the pharmaceutical industry, which manufactures the drugs that keep people healthy, and we have the payers, the health plans. And then right in the middle of everything are the PBMs, and that it is driving up costs. And the pharmacies are part of the provider system, and so that's the issue. It's driving up costs for everyone.
I got you. No, and I guess the upshot, and I am going to support the bill. I obviously think the confidentiality provisions for me are probably most problematic. And then secondly, just the upshot of obviously everything we try to do here is help. We want to help the consumer. And frankly, at the end of the day, I'm not sure this does. I hope it does. And I think everything you say, if comes true, could. But if this is merely a fight between two entities on who keeps more of the profits within the system, then obviously, it's problematic to think of that as the outcome.
Yeah, it's about an industry that's driving up costs and destroying pharmacies, and that is incredibly harmful to consumers. Losing your neighborhood pharmacy is also very harmful. It's certainly not the only issue. I have this afternoon in Health Committee, I have SB 363, which is where we are trying to have better accountability for the health plans for their inappropriate denials of people's care, and more accountability there. So this is certainly not the only issue, but it is one of them.
I appreciate that. Appreciate your advocacy and just how passionate you are. And when the time comes, I will move the bill. So thank you.
Thank you, Senator. And as someone that has delved a little bit into this space with my legislation in years past, the complexity and confusion in the system is oftentimes by design. It's something that's been created because it's very difficult then to change anything or to, and in many ways you do have to attack it from many different angles and many different pieces of legislation. I think to the Senator's point, the complementary nature of not just with the trailer bill, but with other legislation that's happening is somewhat required to some extent, unless I do have a bill in mind that could probably handle all of it at one time, but we'll get to that one later. Yeah. And so, and look, I've had, in my time in the Assembly, I've had 2 ribbon cuttings for independent pharmacies. They've both closed, and actually both have been closed for a number of years now. I think that speaks to part of what, that competition is a healthy competition. That being said, there's different ways to approach it. I go to the pharmacies at least once a week for my father, it seems like, and different pharmacies trying to figure out, it's like a combination of, it's a lot of work to have to figure out how to get those things done. But that being said, continue to work with the administration and with the opposition in terms of some of the concerns raised. I know that this conversation has been happening for a long time, and there's going to be some disagreements. The legal ones oftentimes do end up in court if there's just at the end of the day, just a disagreement on a legal issue. Okay, well, that's what our courts are for. We can't necessarily make that decision here today as to who's right on that. I'm not a judge up here, but I will say that I do appreciate your efforts in this space, and encourage everyone to keep having those conversations. And we don't have a quorum, but would you like to close?
Respectfully ask for an aye vote.
Thank you.